Hello and good evening. I'm Althea. With great pleasure on behalf of the entire team, I welcome you today to today's meeting. We truly appreciate each one of your presence here this evening. The following is an overview of the purpose for this evening's gathering: to discuss CCG funding distribution, new funding schemes, addressing problems and questions that arose during the previous meeting held on the 22nd of February 2021, that is, highest ranking CCG's strategies, and updated research on CCG ranking of Peterborough, Cambridgeshire. I would now like to pass on to Charlotte, who will lead the rounds.
I'd like to introduce everyone from our action team. Please can everyone introduce themselves, share what school you come from, and briefly describe how you're feeling about our progress so far. I would also like to take this opportunity to open up the chat for everyone else to introduce themselves and share their thoughts. So hi, I'm Charlotte, I'm from the Peterborough School, and I'm very proud of all the work we've all done so far. Daria?
Hi, I'm Daria, I'm from the Peterborough School, and I'm feeling grateful about our progress so far.
Amelia?
Hi, I'm Amelia from the Peterborough School, and I'm feeling really proud of what we've achieved.
Amira?
Hi, I'm Amira, I'm from Thomas Deacon Academy, and I'm feeling content about our progress so far.
Arta?
Hi, I'm Arta from Thomas Deacon Academy, and I'm feeling hopeful about our progress so far.
Alicia?
Hi, I'm Alicia from St John Fisher, and I'm feeling really positive about our progress so far.
Erin?
Hi, I'm Erin from St John Fisher, and I'm feeling motivated by our progress so far.
And Althea?
Hello, I'm Althea, and I'm also from the St. John Fisher Catholic High School. I am feeling amazed and grateful about our progress so far.
And now we will give MP Paul Bristow a minute to introduce himself.
Well, look, thank you very much for again inviting me to meet with you and for introducing yourselves. And do you know something? Which is a really difficult day for Peterborough today, because you've probably heard the news about John Lewis. So it's not been a great day. But meeting with you guys and seeing your positivity has cheered me up. So thank you very much indeed.
Thank you, MP Paul Bristow, and thank you, Charlotte. Now I would kindly ask MP Paul Bristow to update us on the progress from his side so far.
Well, I've done a couple of things since we last spoke. The first thing is I've met with Dilraj from Peterborough Citizens on a couple of occasions so far, and about how we might continue to work together. On one occasion, we spoke while I was frantically looking for my child who I'd lost in one of our city parks, but I found her again, so that's good news. But we've worked together and talked about how we might work together. But perhaps the most important sort of piece of news that I've got for you in terms of progress so far is that as you may be aware, I'm a member of the Health and Social Care Select Committee. And the Health and Social Care Select Committee, their job is to scrutinise the performance of the Department for Health, NICE, various CCGs, basically the health service in our country, and those bodies that govern the NHS. And I talked, we were doing an inquiry about mental health in young people. I talked about how I was inspired by yourselves and your work. So you've all had a good mention there. And what's really important though is as a result of you contacting me, I prioritised an inquiry into young people and mental health, and that started earlier this week. So you've made a difference already, that the select committee is now looking at young people and mental health. You should feel very proud of yourself as a result.
Thank you, MP Paul Bristow. Oh, sorry.
Just one other thing as well. Where I pulled you in, which was quite interesting, is that they were talking about a number of ways that young people in school are supported through mental health. They talked about counsellors, like some of the devolved nations have done in every school, but they also talked about the ambition to get a quarter of all schools in the UK with a trained mental health professional working within them. And it was all about this. But one of the things I did talk to them about was something you mentioned to me, was the importance of peer-led review or peer-led validation of young people's mental health. I think that's really, really important, that as well as having those professionals in place. And it's horses for courses, but because I think certain schools will want the professionals, certain people want to talk to those people, certain people want to talk to counsellors, certain people want to talk to teachers. But I made sure that peer-led validation of their experiences during COVID, using you guys as a case study, was reflected. Will certainly be reflected, hopefully, in our final report.
Sorry, Paul. Sorry, Althea, just to jump in. Could I ask you what the inquiry is that you're talking about? What are you hoping to sort of gain from doing that? What will it involve?
So the Select Committee produces quite influential reports, and they make recommendations for policy, okay? And their job is to scrutinise the NHS and the workings of government and the NHS. And so the Select Committee will now, as a result of this, produce a report that makes key recommendations on how to support young people and mental health. And the fact that this inquiry is happening is in no small part down to yourselves.
Thank you.
What do you know what I would do if I were you as the next step? I think you should look at the inquiry, and I'll send to Diraj the details of the inquiry, and I think you should submit written evidence. Might need to, get your skates on slightly, but I think you should. I think I will do that in the morning, and you guys should submit written evidence to the inquiry. So then so rather than me just talking about how wonderful you are, you'll have a written evidence of your contribution to this inquiry.
Yeah, that would be really, really good, because I was going to ask you if we'd be able to sort of get involved and actually speak to them about our own experiences, but I think that'd be a really good way to do it.
I'll talk to the clerk tomorrow, and I'll make sure they get in touch with you.
Thank you.
Thank you, Mr. Bristow. We're grateful to you for working with us on this project and being a voice in the Parliament. I will now request Amira and Arthur to share their updated research on the Peterborough's CCG's ranking.
Hello, as requested from our last meeting with Paul Bristow, we have gathered some of the research we conducted which suggests why the Peterborough and Cambridgeshire CCG is one of the worst in the country. Firstly, one of the reasons would be the low referral rate. As you can see, both tables show the percentages of referrals not accepted, deemed inappropriate, or signposted elsewhere. However, when comparing the figures on the left to the ones on the right-hand side, it is evident that along with other CCGs in the country, the Cambridgeshire and Peterborough CCG has one of the highest proportions of referrals that were rejected. I will now be handing over to Arthur to go through some of the other reasons.
Another reason for our local CCG being the worst is the waiting times for treatment, as they're extremely long, and when compared with being shorter median waiting times. The Cambridgeshire and Peterborough CCG is 12th worst for waiting times in the country. Can I have the next slide, please? Also, although the rating of the Peterborough and Cambridgeshire has risen from 2016, when it has deemed inadequate, it has still been rated as requires improvement, and it has been suggested that there is a result of underfunding. So, Paul Bristow, based on the data you can see on the presentation, how do you feel that we are performing so badly in comparison to better CCGs nationally?
Hi, can you all hear me still?
Yes.
Okay, I can't see you because of the presentation stuff. But look, no, I think you make a very valid point. I mean, the performance from our CCGs is just not good enough. Now, look, there are a couple of issues here. Requires improvement, inadequate. Yeah, I mean, look, there's a couple of issues here. Funding is clearly an issue, and I've said this in the past about. I think some of the funding formula for Peterborough doesn't really. Certainly for the Peterborough end of Cambridgeshire, is not fit for purpose. The formula doesn't work for our city. It underestimates our population. There are lots of people who live in Peterborough who don't show up on the official list. Now, there's got to be a formula that applies to across the country, but it's clear the formula doesn't work for Peterborough. And so it's my job to make that case. And it's not just for health resources, it's also for local government and education as well. And that's what, in part, the census is all about. So we'll wait until the census is over, and I think hopefully things will change from then. But what really needs to happen is that formula needs to change. So Amy's saying, oh, we need an extra X million for this, that, and the other. But ultimately, that's not going to be addressed until the formula changes. And I guess that's a long-term thing that I've got to go for. But what we can actually the key to this is to try and improve the way the CCG works, because it's not just about money. It's the fact that I think the CCG is not doing what it's supposed to be doing, and that's kind of reflected in some of the requires improvement, inadequate, etc., etc. The long wait, the fact that it rejects referrals, and so there's something fundamentally wrong in the state of Denmark. You know, there's something wrong with that CCG, and it's for all of us now to discover why that is. And you've got a huge, well, it's not why that is as well, it's also suggested for the future. And I think some of the work you've done is crucial in that regard.
Can I just jump in with regards to what you said about the funding formula? Once the census has been completed, what sort of changes were you looking to make to better adapt it for Peterborough and its diversity?
Well, the funding formula used, you know, is based upon the 2000 and what are we now? So it'd be 2011 census, and the population of Peterborough and Cambridgeshire is very different. Certainly Peterborough is very different in 2021 than it was in 2011. So hopefully, if everyone fills in the census, we'll get more money because more people will be registered as living here. So that's first and foremost. Secondly, though, and this is more fundamental, so we can solve in a short term the problem by making sure everyone's registered. But the second more fundamental problem is that the formula doesn't work for Peterborough. It assumes Peterborough to be a similar city or similar town to other comparable cities with similar populations. It doesn't actually take into effect that Peterborough has a large number of temporary residents, people who live in short-term accommodation. It's not just about demographics, it's more about churn, to be honest with you. If you're settled, it doesn't matter who you are or where you're from. It's the fact that we've got many unsettled residents here and people living for short periods of time in temporary accommodation. But those people still need and use services. So I need to make the case, which I do all the time, certainly in terms of local government, that Peterborough needs to be treated slightly differently. Now we've got that with local government. The government has accepted that there is a fundamental issue with the way Peterborough is funded, i.e. it doesn't get enough money because the formula is wrong, and they've addressed that balance by basically giving the council more money and allowing it to, it's quite complicated, but to capitalise its assets rather than use capital funding for revenue funding. So capital funding is where you build something and you use capital funding to build or create something. Revenue funding is what you spend each and every year in order to fund those services. But it's allowing, typically the government don't allow you to use capital funding for buildings, for example, just to fund day-to-day services. But it's allowing Peterborough City Council to do that because of its funding imbalance. I need to work with our NHS to make the same case that Peterborough City Council have very successfully made for our NHS and local health service. I'm sorry that's a bit complicated, but fundamentally that's what we need to do, because the government, not ideologically, doesn't recognise, just for statistical reasons, doesn't recognise the challenges that Peterborough uniquely has.
This was a question that I was going to ask later, but it's cropped up quite nicely here. I was wondering if, because obviously it was Census Day on Sunday, if there was any action taken to ensure that the hidden populations, or try to ensure that they did show up on this year's census?
Yeah, I mean, Peterborough have put in a significant, the City Council, whose responsibility, I think it's the responsibility of the City Council. But anyway, the point is that I know there's been a particular effort to encourage as many people in Peterborough to fill in the census as possible, to try and capture that hidden population. But tell you what, there's the same problem as a place like Boston, or a place like Wisbech, or a place like Spalding, or a place like Bourne, you know, with those sort of hidden populations. The difference is that we're so much bigger. But there has been a particular effort to try and capture those populations with the census, because we need them to show up on the figures to get the appropriate funding.
I had a quick question. Since you mentioned about because of the fluctuating population due to temporary residents in Peterborough, because people keep on moving in and out, we all are aware about the new university campus that will be setting up for the academic year of 2022 September. have you all taken any precautionary measures, or have you considered pitching that in for greater funding? Because we will be welcoming a large amount of youth, which again is our main aim, that is to get more funding for the youth of Peterborough.
Yeah, I mean, that's a very, very good point. So you're right, we need more money to build and then ultimately support build our university, then support the university student population. So the first point of that is we've been very successful in obtaining £16 million from the government to help with the university project. I think the Levelling Up Fund, which is a fund the government are given to places which have potential, and that includes Peterborough. We're at the very top of that list. I'm working with the City Council to create a bid for that, and hopefully we'll be successful in that regard. But with students do come other funding opportunities and other revenue opportunities, and I will certainly be making those cases. Just on the other thing, I also actually believe it or not, I think we will get new young people come to Peterborough as a result of the university. I think that's absolutely right. But I wouldn't imagine the experience is going to be like other university cities typically that you see. I see the university as very much a technical university, specialising in science, technology, engineering, manufacturing, some of the things that really made Peterborough what it is, in the past. It's a working city. And to that end, I see a lot of the people who will go to the University of Peterborough coming from Peterborough themselves, or at least the surrounding areas, which I think is good. I also think I'm encouraging each and every day those responsible for developing the curriculum at the university to reflect some of the needs for the population of Peterborough. So, for example, we've got a large Muslim population in Peterborough, and especially the female. A lot of what I hear is a lot of them want to study law or accountancy and don't necessarily want to travel to the other side of the country to do that. And so I as well as the science, technology, engineering type courses, I can see it offering perhaps law or accountancy to try and encourage some of our homegrown students to remain in the city and not go to the other side of the country, because then the risk is we lose them forever.
Thank you, and I would also like to thank Amira and Arthur. Evan and myself will now present on the highest ranking CCG's strategies.
Sorry, everything went a bit funny on my screen. Yes, so I started the research by looking at Cambridgeshire and Peterborough CCG as a baseline. And I was sort of focusing on it in terms of population and budget. So in one source, I found that the population of Peterborough CCG is over 998,000. That was in the annual report. It is also one of the least well-funded health systems in the country. We receive less per person for spending on healthcare than our neighbouring CCGs. We have a budget of 1.3 billion. And this equates to roughly £1,456 per person.
One of the main questions raised in the previous meeting was, what are the highest ranking CCGs doing to be the best? Well, here is some research on their strategies. Barnsley in particular did not have any reliable source for their population and their budget, but they did have some clear strategies, which that they created mental health support teams that would work with schools, colleges to provide a link with specialist NHS services. So it's a direct link from the school with the help of mental health support teams to the NHS service. They also decided that they will build on and increase support that is already present rather than introducing new schemes, because it would be more reasonable to do so. Next slide, please.
So when the next slide comes up, I looked at populations of other outstanding CCGs based on the research of Peterborough's population that I'd done. I tried first to look at CCGs that had a population similar to or the same as, oh, I think Charlotte's just cut out. That's okay, I'll carry on talking. So I first looked at CCGs that had populations that were similar to or the same as Peterborough, but none of these ranked above good in the 2019 to 2020 rankings. So I then looked at all the outstanding CCGs, and the CCG that had the closest population to Peterborough was Leeds CCG, that ranked outstanding. This had a population of, I think, 780,000 roughly, which is still 100,000 less than Peterborough. And all of the other CCGs then had populations far below ours that ranked outstanding. So Charlotte is back now and she will put the PowerPoint back up, hopefully.
Sorry, my internet cut out. Oh, 1 second, sorry.
That's okay, don't worry. I do have some questions though from the PowerPoint. So yes, there's another group of young people that are working alongside us, who are working with Catherine Goose from the CCG. And the two main things that they are doing is they are creating an interactive roadmap on a website so that young people are able to find exactly where they need to go for help, as that is one of the main things that came up in our listening that young people struggled with when it came to sorting their mental health and getting the support that they need. And they're also creating a waiting room app for young people that have been diagnosed already, that they can talk to each other in and find help among their peers. The CCG is also moving to a one point of referral system that should make the whole system easier. So Paul Bristow, would you be willing to meet with the CCG or our CCG team to discuss how you can aid them in taking these actions to make tangible improvements to our services?
Well, absolutely, of course, I'd be very, very happy to do that. I think you've done some excellent work, and I think this is what the CCG need to hear. So I'll be very, very happy to do that. I mean, would you want me to instigate that meeting, or do you want me to just attend, or do you want me to organise it?
It's a meeting that we could set up, I think, working alongside the other team, with Dilraj and Tim as well.
Okay, I'd be very happy to do that, yes.
Yeah, that'd be great. And the last question, I think, Charlotte, thank you, is how can we improve the funding to implement some of the actions? I know you've already talked about the funding formula, yeah, but is there any way of ring fencing funding so that it can be used in sort of these actions that we would like to take?
I think what I need to do is, what we don't really want, I don't think, is for us to go to meet with the CCG and they just shrug their shoulders and say, well, you know, it's funding. You know, I mean, I think that would be quite an unhelpful meeting. I don't want them to just turn around and use the excuse that they're underfunded. And I'm not suggesting they are. They're not underfunded. I think they are. But you know, I don't want that to be an excuse for inaction. I think we need to make sure that we have some clear asks about what we want them to do and how they can ring fence that funding. And that requires some thought, I think.
Thank you.
I would now like to pass on to Alicia, who will share some information on new schemes and funding.
At the beginning of the month, the government was granted £79 million to mental health support teams within schools, as well as child adolescent mental health services. This scheme has been given in the hands of the new Ambassador for Mental Health, Dr. Alex George. On the 5th of March, Boris Johnson and Dr. Alex George spoke to a group of young people like ourselves regarding lockdown and how it has affected their mental health. And they all agreed that it has detrimentally affected our mental health. socially, academically, and then most importantly, our mental health. Young people have been uniquely affected by this pandemic and lockdown, and with NHS researching that 1 in 6 of us may actually now experience a mental health problem, up from 1 in 9 in 2017. Dr. Alex George states that he wants every person in the country to know that they can speak out and access support when they need it. He wants to encourage a whole school approach to mental health, and he reiterates that going back to school in March was about more than just getting back to academia. It was about improving positive mental health and well-being. Also this week, one of our members of the team, Irene, took part in an interview with BBC on Sunday. During the interview, she discussed her own personal struggles with anxiety during the pandemic and the urgent need for funding for the mental health services in Peterborough. Nadine Dorris, Minister State of Mental Health and Suicide Prevention, stated that this £79 million would be available for children and young people. Next slide, please. Paul Bristow would like to ask that with regards to the major funding given to the mental health service sector, what new measures will you put in place for Peterborough, and does the city get access to the fund?
Well, I mean, it should be access to wherever needs it. I think that that's a really good point. Why don't we invite, why don't I write a letter to ministers and Dr. Alex and ask that Peterborough, or at least Peterborough and CAMS get a signal. I'll talk to the CCG first, but I'll ask that we get a substantial part of this funding because of the way that Peterborough is inadequately funded. And why don't we ask Dr. Alex to come and talk to you?
Yeah, that's a great idea, because the meeting that he had with the young people, it gave Dr. Alex a real insight to young people's experiences with mental health. So I think a meeting with him would be great.
Just keep my wife off the call. I think she quite liked him when he was on Love Island.
Oh, sorry, I was on mute there. We'd also like to ask whether some of the £4 billion levying from the announced budget for Peterborough is judged as a priority and could be ring-fenced to the children and young people's mental health.
Yeah, I talked about that earlier, about the Levelling Up Fund. I'm not sure. The problem with the Levelling Up Fund, what that's designed to do is it's for more capital projects, to build something, but there may be other pots of money associated around levelling up that we can look at, and I'll get my office to take a look at some of those. Can't promise anything, but the Levelling Up Fund is. I'll get my office to take a look and see what opportunities there are around other similar types of investments. I don't want to promise something if we wouldn't be allowed to do it. So let me go away and have a look.
What exactly does the 79 million awarded to Dr. Alex mean for Peterborough? When will the support start making a difference to Peterborough, and when will we see the change?
Yeah, let's as I said, I will write to the I'll talk to the CCG and then write to whoever is necessary to see if we can get access to that funding and that support. And I'll write to Dr. Alex.
Thank you very much, Alicia, for that informative research. The following is a question and answer session that will be led by Daria.
Hi, Paul. Thank you so much for all your promises so far. We now have some general questions for you. You've heard a lot about our vision for mental health in Peterborough, and we just wanted to understand what exactly your vision for mental health service in Peterborough is, and what efforts you've put in individually to achieve this vision so far.
Well, I mean, I want to see a city where every young person is able to reach their potential and not be hindered by a lack of support if they have mental health challenges. So I, as a Conservative, if I believe in anything, it's that it doesn't matter who you are, what your background is, or what challenges you might face. If you've got the potential, you work hard, and you've got the aptitude, you you should be able to reach your potential. That's the essence of everything I believe. And I don't think mental health should be a barrier to young people reaching their potential. I think probably the most effective thing I've done since becoming an MP to help I realise that our vision is work with you, and listen to you and listen to some of your vision, because some of the things that I've done in terms of putting down questions in Parliament, meeting with the CCG, the Health Select Committee inquiry, is down to you. Now those are very sort of national macro things. I think we need to start doing some work to try and make a difference here on the ground in Peterborough. But some of those things, we've discussed those things today.
Could I jump in there? Sorry. With regards to your vision about what you see Peterborough's mental health services could look like, you spoke about all young people needing a place to go when they have mental health problems. With the research that I've done with the 79 million with Dr. Alex, it's proven that the funding is the crucial key to these changes. And even though the census will hopefully hold this key, when it was done, the last time it was done, it didn't improve the funding. So do you have any more initiatives and plans to improve the funding in Peterborough?
Yeah, I mean, I wouldn't be completely. I'm not suggesting funding isn't an issue. It is, and Peterborough needs its fair share. But I wouldn't fall into what I would argue is, and I don't want to do them a disservice, but I wouldn't fall into what I would say is CCG's trap, which is, we can't do anything. It's all too difficult. We need more money. Well, I'm not sure that's good enough, to be honest with you. I accept funding's an issue, but they do have money to do what they should be doing, and they're not doing that. And I think that's where we should start. I can do the funding, yes, and I can address some of those issues, but they're not going to be resolved by a click of the fingers. What we need to do is make sure the CCG do the best they can with the resources they've got, and I'm not sure that's the case at the moment.
Sorry, before you go on to the next question again, I now have a question. The work that I talked about that the young people are doing with the CCG at the minute, I know that work is already going ahead. For the website, definitely, they're having a meeting with the web designer in April to get that started. They're not waiting for the funding. My question was more sort of that, would you support them with further funding to ensure that these services are kept up to scratch almost, so they can start them now?
I mean, I can certainly joining lobbying efforts to secure fairer funding, but what I mean is, and I know you're already working with them, but what I'm saying is we've got to keep the pressure on. We can't just leave them to it, because there are things that they should be doing, and there are things that they should have done, and clearly they've not done that in the past. Now, hopefully, we can address these issues moving forward, but certainly for the past, there are things that they should have done and they haven't done.
Thank you.
What power do you have within mental health to make a change?
Well, I don't have much power, but I have influence, and I can make certain calls, and I think that's what I'm doing, and that's how I'm working with you today.
Could you please update us with your progress with joining the all-party parliamentary group for mental health?
Yes, I've joined it, but they've not met yet. They've not met since since we last spoke. But I've joined it.
I had a question on this as well from the last meeting that we had. You said, I'm very, very happy that you've joined it, but you said in the last meeting that you hadn't really heard of it before. Is it not a very well advertised thing to MPs? Is that something that could be improved?
It's the fact that there's about there's probably about over 1,000 all-party parliamentary group on 1,000 different issues.
Okay.
You know, and it's just lots of them. I'm sure they're doing good work. It's just there's 1,000 different groups, and you know, one has to actively seek it out in order to hear it. If you understand what I mean.
Yes, that makes sense. And another question regarding the all-party parliamentary group. Since joining it, do you know what their initiatives are?
They've not met yet, but I will certainly go and meet them the first opportunity I get.
Thank you.
I also have a question about the all parliamentary group. What ideas and visions will you be bringing to the table for to improve children mental health services in Peterborough?
Sorry, I missed that question. You cut in and out for a second. Apologies.
So with regards to the all parliamentary group, what ideas and visions will you bring to the table to improve mental health services across Peterborough?
Well, I think I need to wait and find out what their work programme is. I mean, I don't want to go in there and take it over. They won't let me. But I think, I think certainly the most important thing I could probably do is reference like I've done with the select committee, a body which I already sit on, is reference your work and try and use what you're doing to try and influence some of the reports and some of the recommendations they make. An all-party parliamentary group is, they can be effective, they can be ineffective. They complement and criticise policy strategies of the government, etc., etc. So I think we just need to make sure that they're doing what they're supposed to be doing.
Have you made any progress with inviting James Palmer to the Mayoral Assembly?
Yes, I spoke to Dilaj about this, and he's said that he's happy to go and has asked for an email, but I probably think she's emailed him probably many times, but hopefully he'll respond to her now. But I spoke to him yesterday about it.
Thank you. We can also forward you a list of questions that we've compiled to be asked in the House of Commons. We can email them to Rosie, or we can just drop them in the chat. So
don't drop them in the chat because they'll get lost forever. Email them to Rosie. She's organised and diligent.
Thank you, Daria, and of course my fellow teammates for the input, and of course Paul Bristow for your answers. I would now like to pass on to Amelia to discuss the follow-up meeting and also recap this meeting.
Thank you very much for meeting with us today. We've learned of your progress in initiating an inquiry into young people's mental health as part of the Health and Social Care Select Committee. You've also said it is vital to look into hidden population in Peterborough, which will hopefully improve funding for Peterborough. We're also very grateful that you've said you'll meet with our CCG team and try to organise a meeting with Dr. Alex. We would love to meet with you again on the 21st of April to continue our action for better mental health services and improve funding in Peterborough. Would you be willing to meet with us on the 21st of April?
Of course.
That's great, thank you.
Thank you, Amelia. As we finish up, on behalf of the entire team, I would like to thank everyone here for participating. We all have a single goal, that is to bring more funding for the mental health facilities for the children and youth of Peterborough. Have a nice evening. Thank you.
Thank you. Thank you very much for inviting me along.
Thank you for coming.
No, pleasure.
Team, I'm not going to say anything. You just put on the chat how you feel you have gone from the previous meeting. Look at Tonya, you're already on there. Yeah. Always trigger happy, Tonya, I love it. Okay, so my question is, from last meeting to this meeting, in terms of improvement, especially in pinning, that's a very specific question. Give me a number. Now, 1 being like you don't think you've improved at all, to 10 being you were on fire. Give me a number. 11, love it. Yeah, that was so brilliant. Question now is in terms of anyone that particularly stood out, just unmute yourself and just say, you know, thought this person did really well and why.
I think Erin and Alicia were really good at pinning, definitely. I mean, I know Gerard helped with that, but it takes confidence to just, you know, go in there, even though you're not in the script. So well done, guys.
Thanks, Daria. I thought Althea did a really good job at chairing it as well. She sort of kept the flow through despite us kind of chipping in with more questions every time she tried to speak.
Thank you, Erin.
I think when Charlotte cut out and when Erin kept going, amazing. I wouldn't have been able to do that.
Yeah, I agree with that. I think as a whole team coping with technical problems, it's hard on Zoom, but I think we all coped really well, especially you, Erin. Again, I wouldn't have been able to cope and go like that.
Technical issues are just like a new skill now, like from last year. I think we've all improved massively.
I think the research that you've done as well is absolutely amazing. I mean, really thorough. You know, you really had your points. I like the way it was presented, you know, the graphics. I thought it was excellent. Really, really well done.